I'm sitting here diagnosing you and giving you the treatment, there's 2 or 3 other people waiting for me. So good intention, well-trained physician, but the fact of the matter is we're paid on volume. We're paid on volume. We're not paid on actual quality of health outcomes. Okay, and this is my own story and my own experience about this, which is that as a conventionally trained doctor, graduating out of one of the top medical schools in the country, I think that the only thing I was really taught was how to, diagnose something and what medication to treat. And when I tell people to guess, okay, and I'm just going to ask you to guess right now, guess in my 4 years of medical school, okay, how long did I spend on nutrition, alternative therapies, lifestyle? How long do you think I actually really spent on this? Just think about nutrition. How long do you think I spent on nutrition in 4 years of medical school? People who've heard me talk about this is, I'm being really honest, 30 minutes. So really, in medical school, one of the top medical schools in the country, I spent, literally almost 1.5 years in pharmacology, how to prescribe drugs, and then another 1.5 years just to actually prescribe it in the hospital setting. But how long did I spend on food and nutrition, learning about it? 0. How long did I spend on supplements? Well, no, food and nutrition, 30 minutes. How long did I learn on supplementation, natural herbs and remedies? 0. So kind of think about this. The entire training of all the doctors that you're seeing is really just on diagnosis and medication, or diagnostic testing and medication, or surgeries. And if you don't fall into a clear diagnosis and you don't fall into a clear, guideline of which medication or surgery you're going to do, what other tools do they have to offer you? They really have nothing to offer you, even with the best of intentions. So my story around this is, until I got sick, I was a family practitioner, and I worked for 2 of the largest medical two of the largest medical groups in this country, and I basically was an expert. I was a great family practitioner, great diagnostician, and great at dispensing medication, great at saying, I'm right on this, I don't know what you to do with that, send you to the specialist, really good at just categorizing and passing people along, because you know what, it's like, the compensation model and the way the healthcare system is structured, we basically had to see, 20, 30 patients in a day. And yes, I would spend, if I'm lucky, 15 minutes with you. But if I'm lucky, I only have to spend another 15, 20 minutes that night charting on your chart. And therefore, it was like, we're lucky we get out of the room alive sometimes, and because we're trying to get out of as many, while I'm sitting here diagnosing you and giving you the treatment, there's 2 or 3 other people waiting for me. So good intention, well-trained physician, but the fact of the matter is we're paid on volume. We're paid on volume. We're not paid on actual quality of health outcomes. Okay. And so it's not that I don't care or we don't care, it's that we are trained to actually be almost like mechanics doling out like parts, body parts and treatments to people. And we're actually compensated to churn through as many people as possible. So in that system, and most of us are employed, most doctors are employed. Most doctors don't even own their own businesses. So we're being told what to do and how to do it. And I call it factory medicine. And then I got sick. When I got really sick, and I got sick really complicated stuff, then there was nothing they could do. They offered me antidepressants, pain medication, therapy, because I was cuckoo then, because there's a problem they can't solve. My labs were normal. So, I became my own worst nightmare patient. But in a way, if you think about it, the only reason at this point that I was able to actually solve some of these really mystery and big health problems is I had to receive really bad care that I delivered. That sounds so bad. I had to receive really bad care that I delivered. That is actually the gold standard of care. But the gold standard of care, your guys are right, that are not trained to deal with chronic diseases and complex diseases like autoimmunity, major hormonal issues, cancer, cardiovascular disease, dementia, you name it, right? So I think that you guys are onto something here, which is that the problem is we have trustworthy physicians. Their training really sucks. the compensation with them as employees is for them to churn out volume. And then number 3 is they don't know what the hell to do with really complex medical problems like autoimmunity. So I think the moral of this is, what did I have to do to actually cure myself? Is that I really had to go outside the system. I had to spend my own money, a lot of it, probably $500,000 just in the last 10 years in my own education. That was not paid for by anyone else. It had to be on my own time, my own dime, right? And then I couldn't operate and choose to practice this kind of medicine, which is root cause medicine, in a 15-minute factory medicine model. So I had to go outside of the model. I really did. And that's why we have an online program. For those of you who are already in our Facebook group, why don't you join? Go to the units section. There's a lot of sections where I teach through some of the fundamental pieces that cause autoimmunity and how you can deal with them. For those of you who haven't joined our Facebook group and you're watching from Instagram or YouTube on Facebook outside our group, join our Facebook group, Transform Autoimmune Disease Naturally. And you can check out our website, drmaggieyu.com, to check out what it is that I do and what is an educational model that's done online. What is community and group medicine done in a group online? Learn about it.